Well, whooping cough cases are on the rise in Arkansas. The Department of Health says so far there are 486 confirmed cases. 5 News reporter Laura Castleman talked with area doctors and parents about their fears with the spike in the illness. Laura?
That's right, Morgan. The Arkansas Department of Health says cases are higher than they've been since 2013.
We do see little outbreaks from time to time.
Dr. Susan Everett is a physician at Best Start Pediatric Clinic in Springdale. She's also a grandmother, so she's got her eye on the rising numbers in whooping cough cases.
What most people notice is that they had what they thought was a cold, but then their cough lingered for months, and you have episodes, so spasms of cough basically, instead of coughing all day long.
But that's not the same case for infants.
Younger kids, and especially babies, may not present the same way. For a baby, it might be that the baby can't catch their breath, so the baby can become apneic or have breath holding.
He is vaccinated.
Brianna Way and her son say while they're concerned about the spread, they're confident in their safe practices.
Being that he's at home most of the time and we have a pretty good health routine and he takes his vitamins, and it's just a thing that happens with kids. You know, they get sick.
Cases of whooping cough have been the highest since 2013, with 486 confirmed cases this year alone.
Whooping cough in and of itself is a highly contagious respiratory illness, spread person to person through respiratory droplets.
Dr. Lotredu is with the Arkansas Department of Health and says certain people have a greater risk at contracting it.
We do worry most about infants, specifically those that are, less than 12 months old, especially those that are unimmunized or underimmunized. Their risk for worse complications.
With several illnesses and viruses this time of year, doctors are encouraging everyone to practice good hand hygiene.
Washing your hands and cough etiquette around your friends and family members as we go into the holiday season.
Now, health officials urge pregnant women to get vaccinated to pass antibodies to their babies. Staying up to date on vaccinations remains the best way to prevent the disease. Laura Castleman, 5 News.